Hello everyone. Here we are going to discuss a small topic that is Meckel's diverticulum. You usually get short or very short question in your university exams from this topic, especially on its embryological origin, morphology and sites. So let's start the topic. Meckel's diverticulum. So first of all, I will let you know what is Meckel's diverticulum. Then I will let you know its site, most common site in human body. Then we will see its embryologic origin, which is most commonly asked question in your exam. Then we will see the rules of two, then the morphology and the complications. So let's start Meckel's diverticulum. Before understanding the topic Meckel's diverticulum, you must understand the layers of the GIT. You know, an entire GIT, gastrointestinal tract of human being, there are 4 layers in the wall, including the esophagus, including the stomach, including the intestine. The 4 layers are, they are in front of you. I guess everyone knows the innermost layer is the mucosa. You can see it here. This one is mucosa. After mucosa, just below the mucosa, there is submucosa. And after that, there is muscularis propria. You all can appreciate this is muscularis propria. And outermost one is the serosa. So you can see this is the serosa. So these are the 4 layers. Now, before understanding the topic Meckel's diverticulum, you must understand what is diverticulum. So there are 2 types of diverticulum. Let me explain the 2 types of diverticulum to you. True diverticulum and pseudo diverticulum. What do you mean by true diverticulum? As I told you, the GIT have 4 layers. If all the 4 layers are protruding out, all 4 layers protruding out and producing a outpouching. Can you see here outpouch? The wall of this outpouch contain all 4 layers. That is, it contains mucosa as well as submucosa as well as muscularis propria as well as serosa. So the wall of the outpouching containing all 4 layers, that is known as true. That is known as true diverticulum. This one is true diverticulum, in which you can see all the 4 layers are protruding out and producing a pouch, outpouching. That is known as true diverticulum. In the pseudo diverticulum, only mucosa is protruding out, not all layers. All layers do not protrude out. You can see here very clearly only mucosa is protruding out and producing a pouch. So here the wall of the pouch do not contain the all layers. It contains only mucosa. Here in true diverticulum, it contains the all the layers in the pouch. Now let's come on the topic Meckel's diverticulum. What is Meckel's diverticulum? Meckel's diverticulum is most common congenital anomaly of the GIT. Among the GIT, most common congenital anomaly is Meckel's diverticulum. That is one thing you must know. No, it is a true diverticulum. It is a diverticulum. So you know the 2 types of diverticulum, true and pseudo. So Meckel's diverticulum is true diverticulum or pseudo diverticulum. So I'm saying it's a true diverticulum. It's not pseudo. It means it is the protrusion. It is the protrusion of all 4 layers. So it is the outpouching which contain all the layers of the GIT in their normal orientation. It's a true diverticulum which contain all 4 layers, mucosa, submucosa, muscularis propria as well as serosa. You can see it clearly. So that is the introduction, the definition. Now what is the most common site? It is present in intestine. In human intestine, in small intestine, we are having 3 portions. We are having duodenum, jejunum and ileum. So this one is present in ileum. Most commonly it is present in ileum. So you can see this is the wall of the ileum. You can see this is ileum. You can see this is ileum and it is opening in the cecum. This is ileocecal junction. You can easily make out this is ileocecal junction. So it is present at about 1 centimeter above the ileocecal junction. 1 centimeter above the ileocecal junction. This is Meckel's diverticulum. You can see it's a protrusion. You can see it's a outpouching from the wall of the ileum. So it is present. Name the organ. So it is ileum. Where in the ileum? In the entire ileum. Ileum is very long, many meters. So how much, where it is present exactly in the ileum, the location? So it is present nearly 1 centimeter above the ileocecal junction. So where it is present. Now in the ileum, we are having 2 borders. What are the 2 borders of the ileum? Let me explain you the 2 borders. So this one is known as mesenteric border where mesentery is attached, and this one is anti-mesenteric border where mesentery is not attached. So Meckel's diverticulum is present on mesenteric border or anti-mesenteric border. So this one is present on the anti-mesenteric border. You can see it clearly. It is present on the anti-mesenteric border. So where it is present? It is present in ileum. So let me draw a ileum for you. This is ileum. Now this is the mesentery attached to the ileum. This is complete mesentery. So this border of the ileum is mesenteric border. This one is mesenteric border and here no mesentery is attached. So this one is known as anti-mesenteric border. Anti-mesenteric border. So where is the Meckel's diverticulum? Meckel's diverticulum is present on the anti-mesenteric border nearly 1 meter away from the ileocecal junction and it is present in the ileum. So, and it's a true diverticulum. So you have to write everything about it. This is the location. You can see it clearly. You can see this is the ileum.